Pain in abdomen is a symptom in a woman which is considered to be a normal phenomenon during her reproductive age group and is considered to be tolerated, and even if it affects her daily routine, and should not be really considered to be checking out with a doctor. But that's not true. Myself, Dr. Ankita Chandna, Associate Director, Max Super Speciality Hospital, Shalimar Bagh, will talk about a very important topic in women's health, that is endometriosis. What is endometriosis? Endometriosis is a condition in which the lining of the uterine cavity, that is the endometrium tissue, that periodically sheds during periods, grows outside the uterus in abnormal areas like the ovary, the back of the uterus, goes to the bowel, and it can be growing in the anterior aspect of the uterus and goes to the bladder. So what happens? Basically, this tissue, which is an abnormal area surrounding the uterus, incites a lot of inflammatory reaction, causing a lot of scarring, and in that relation it causes a continuous pain in abdomen. This endometriosis is a condition which is, it comprises about 10% of all the ladies in reproductive age group, and hence the incidence is very high. Currently, it is affecting about 200 million women all over the world. So we need to really address this situation, understand, be aware, and get a timely management done to prevent its progression to the severe form. So basically what happens in endometriosis, when the abnormal tissue which is surrounding the uterus during menstruation, it grows, it causes pain, it causes scarring, can lead to a lot of discomfort in the women in form of painful periods. Then it can cause pain even while passing urine, pain while passing motion, sometimes difficulty in sexual intercourse, and later on, if the disease is widespread, can cause infertility, difficulty to conceive. So hence lies the importance of the diagnosis. Earlier the diagnosis and management is little better as compared to when it is a very severe form. How do we differentiate a pain of endometriosis from a pain of normal menstruation, which usually is considered to be a normal phenomenon? We should understand, if there are a lady suffering from a painful period, she'll usually have the pain during periods. There will be bloating sensation, the breast soreness can be there, and there can be lower backache. But what happens with endometriosis? The pain is quite severe during the periods, and otherwise also it stays. It doesn't diminish totally. And like we discussed, if it is surrounding the bladder, the urinary bladder, or it surrounds the intestine, it causes sticking of these organs to the uterus, and that is a time when she can have a lot of problem and pain while she passes urine, while she passes motion, and even like we discussed about intercourse. What should be done? Basically, the time of diagnosis from the disease symptom is usually 6 to 7 years documented because of the late presentation. Women usually are given the notion that you should tolerate the pain of periods. It's okay to have a periodical pain. You should tolerate even if it is affecting your day-to-day life. No, that is a myth. You should actually meet a doctor, consider going for further testing, and get yourself checked if basically it's just a normal period pain or you're suffering from endometriosis. What are the diagnostic techniques available to check for endometriosis in a woman? The specific biochemical markers are still under research. We don't have that available right now, but imaging techniques can give us an idea about the development of ovarian cyst or even an MRI, which is because of the endometrial tissue on the ovary that causes blood-filled cyst in the presence of the ovarian tissue. These look like a chocolate cyst or enlarged ovarian cyst on the ultrasound. Again, after that, once a diagnosis is established and the clinical pictures are also, mimicking endometriosis, what should be done? Basically, we understand that this incidence being 1 in 10 in all women of reproductive age group, there is no specific genetic cause related to the endometriosis, but again, that is one consideration we have to see, that if a woman in the family has a first degree relative who has endometriosis, has a chance of about 6 times to develop this disorder. Again, once the diagnosis is established, we need to counsel the patient about the condition. We need to explain that this is not normal and that she has to undergo further treatment. Here, basically the risk factors which are involved are the prolonged menstruation time of a woman. So early menarche or a late menopause, delaying of childbirth, all this exaggerates the presence or diagnosis of endometriosis. And again, obesity is also a risk factor because of the fat deposition in the body that exposes the lady to prolonged estrogens. Estrogen is the main hormone which is more responsible for the endometriotic tissue to grow in the abnormal site. Once we know that the diagnosis is established, what are the treatment modalities available? So thorough counseling should be done. We should understand whether a lady has presented to us with what symptom. Is it just the pain in menstruation, pain during intercourse, or is she having any kind of infertility? Infertility, we should explain, is basically because of the cyst formation in the ovary that traps the eggs, and hence the fertilization doesn't happen. Again, like we discussed, a lot of scarring and sticking of organs to each other happens during endometriosis. That can also affect the relationship of both the fallopian tubes with the ovary, and hence the fertility is affected. So the treatment will depend upon what kind of management she is wishing for. Basically, initially for all kind of pain, painkillers are being given, that is any kind of non-steroidal anti-inflammatory agents, simple like crocin, paracetamol can be given to the lady. But that is not a definitive cure. Again, the definitive cure lies in the medical hormonal therapy or a surgical therapy. Medical therapy are hormones which are progesterone, or they can be a combined pills, or they can be long acting injections so that the ovulation is curbed, but that will not help her to conceive. So this is not the right line of treatment if you are actually wanting to manage an infertility lady. But yes, it can at least take care of the pain and the further deterioration of the severity of the disease. These pills or hormones are though not long lasting. We can give them only for a certain time because of their side effects, and they cannot be just given for a very prolonged use. So final stay of the treatment, if she doesn't respond, is surgery. Surgery has a best optimal response to this kind of a problem, and the basically surgical techniques which are used are laparoscopy. That's a minimal invasive technique wherein many holes are created on the abdomen of the patient. Instruments are used to look within. They see the organs, how much they are affected, the presence of ovarian cyst, if there is any adhesion, that is a stickiness of the organ to the uterus, all that can be first assessed and it can be managed accordingly. The cysts are usually removed, leaving the ovary behind so that the normal ovarian tissue and its function doesn't stop. The tubes which are kind of sticky or they are causing the infertility can also be cleared. Then the bowel is separated and the bladder is also separated so that the pain which she experiences during during passage of urine and motion is not there, and that has a very good result. But see, the menstruation has not stopped. So any surgery can give you benefit for some time, but there are chances of recurrent surgeries because the condition doesn't stop on its own. We know the final outcome of the treatment of the surgery would be removal of the uterus, the tubes and the ovaries, which usually a young lady would not wish for. Hence, the laparoscopy surgery is taken as a first line of surgical treatment to help the women to conceive, to take care of her pain for a little long term, and then she is also combined with the medical therapy so that the disease is under control. So basically what we understand is this is a specific management, but what other things as precaution a lady may want to know, what else can I do, doctor, if I take this treatment along with that? We explain them to have lots of fruits and vegetables. These antioxidants help in relieving the scarring. The kind of inflammatory response is also less. Then she should consume good amount of omega-3 fatty acid. In research that has shown to have a proven benefit in women with endometriosis. Then she can have avoid taking trans fatty acids, red meat. That also helps her to lose weight, exercise quite often, lose weight so that the obesity is less, the prolonged exposure of estrogen is under control. Apart from this, we should explain all the women in our house, in the society, that please don't ignore any kind of chronic pain which is long lasting, or a heavy period or a pain during period which is not helping her to do her daily activity. That should be addressed. You should visit a doctor. Since the disease has a very varied phenomenon, every individual or every lady who has this kind of a condition will have a different presentation. So that has to be checked by the doctor, has to undergo an examination, has to undergo certain tests and take a final treatment depending upon what symptoms she has. So the take home message for all the people is, please encourage the women in your family, in your society, to address the problem of pain in abdomen during menstruation and not to consider it to be a normal phenomenon which affects their daily life. You should address this problem to the doctor as soon as possible, take a timely management and prevent yourself from suffering in a severe disorder. Thank you.